what good is it then? And it's probably helped stabilize the leg a little bit. But honestly, I can't give you a definitive answer. So the fibula is always lateral, okay?
So, Dr. K, can I ask a quick question about the test?
Yeah.
Okay, so on the,
Why don't you ask me in private, and then we can hatch over it
Well, I
real
think
good.
we all have this.
I think we all have the same question
Yeah.
about the tendon ligament thing.
Yeah? Oh, okay.
It's number 6.
Let's see it.
Which of the following is a fibrous connective tissue membrane that connects a muscle to a bone?
Fibrous
So,
connective tissue.
fibrous connective tissue membrane.
Oh, but it's fibrous connective tissue pretty much.
So is a tendon a
Fibrous
membrane?
connective tissue is like ligamentous stuff.
Yeah, but is a tissue, I mean, is a tendon a membrane then?
Oh,
Or is that
the word membrane really doesn't matter in there.
Well,
And
there's
fibrous connective
actually,
tissue matters.
but there's actually a thing that's, well, I think it's in
Why
the
don't we
book that
argue about
says.
this, you and I,
Okay,
okay, in private, yeah,
okay,
yeah. So, because we sort of need to move on.
okay.
Uh,
I got that one right now.
Okay, so fibrous connective tissue, of course, is like dense, regular connective tissue. And if it connects a bone to a bone, it's a ligament. If it connects a muscle to a bone, it's a tendon. Okay.
I'll just circle the.
And so there we see the patella encased in this fibrous connective tissue membrane, or whatever you want to call it. And, okay, and there's the tibial tuberosity where the patellar ligament attaches inferiorly. And another picture of the knee, just illustrating the two menisci, which is plural of meniscus. Okay, and so anterior, we see the anterior cruciate ligament, named for its attachment to the tibial plateau down here. Since it attaches to the anterior part of the tibial plateau, it's the anterior cruciate ligament. Prevents the femur from sliding backwards. And this one, here's a posterior view. The posterior cruciate ligament prevents the femur from sliding forwards. So, which side is this, medial or lateral?
Lateral.
Lateral. Fibula is always lateral. So this is the lateral collateral ligament, and that's the medial collateral ligament. Okay. Prevents the knee from sliding side to side. So here we're looking at the tibial plateau with the fibrocartilage, the little menisci on top of it. And they're shaped so that the condyles of the femur fit just right in each meniscus. There's a little ridge in the center of the tibia, and that ridge is called the intercondylar eminence. Okay? And that little ridge also helps prevent the condyles of the femur from sliding side to side. And you can see the posterior aspect of the patella. And here we see a nice view of the fibula. Let's talk a little bit more about the fibula. Back when we were talking about the different kinds of articular protuberances, we talked about a flat articular surface. Okay. A flat articular surface is called a facet. We haven't seen any facets yet, but we'll start to see a lot of them. And here's one right here. The proximal articular facet is what we'll call it. Okay. And the fibula articulates right into this little spot right there. And we have the distal articular facet down here, which accomplishes the same thing, and both of those are synarthrotic joints, so the fibula doesn't move. You know these two bumps on the side of your ankle? Okay. Rather prominent bumps. Each bump is called a malleolus, and the lateral malleolus comes from the fibula. The medial malleolus comes from the tibia. So you should be able to, I could ask you off a picture, name this structure, and it should be pretty easy for you to do. Since it's part of the tibia, it's got to be the medial malleolus. The distal fibula is the lateral malleolus. proximal fibula is called the head of the fibula. So, the malleoli are the bumps on the ankle. Is the medial malleolus on the tibia or fibula?
Fibula.
Remember, the fibula is lateral.
Fibula.
Tibia. There you go. Okay. So the tibia is the weight-bearing bone, and it bears pretty much all of our weight. Okay. And we're looking at the ankle joint right there, which you probably have to say is a hinge joint. Even though I can bend my ankle side to side a little bit, just a little, when you look at the anatomy of it, as we will shortly, you can see it looks an awful lot like a hinge joint. Here's a nasty fracture of the fibula. Okay, so the musculature. You may not think that there are many muscles on your anterior shin, the shin, okay, but there are. There are quite a few of them actually. So we have, of course, the tibia, which is very prominent, and you can palpate the tibia right in the medial part of your shin. But just lateral to that is a muscle called tibialis anterior, which you just can't miss, and it goes down to the foot round. The side of the lower leg, the lateral side, is known as the peroneal or fibular region. And so we have peroneus longus and peroneus brevis that show up nicely on the model. Okay. We have extensor digitorum longus, which goes down to the digits, which are the toes. And then here, the word for big toe is hallucis. Do we have extensor hallucis longus on here anywhere?
Yeah,
Yes.
we do.
Anyway, this, if you trace it back up, goes to extensor hallucis longus. Where is it? It's on the lap anyway. So the muscles on the anterior side of the lower leg are extensors, because when they contract, your toes curl up, and that's an extension. It's like bending your fingers back. When your toes curl downward, that's a flexion. The muscles on the posterior lower leg are flexors, and the ones on the anterior lower leg are the extensors. So, and hallucis means big toe. So the individual extensors, we have tibialis anterior. There's extensor hallucis longus. Some people pronounce that hallucis. Hallucis I hear more often. Extensor digitorum longus. And one thing you'll notice around the ankle is that many of the tendons cross. If all the tendons just went straight down to the structures which they control, it wouldn't be nearly as stable. The tendons would tend to become separated with the huge weight that's bearing down on the ankle. So the ankle is just loaded with tendons. That's about all it is bone and tendon. And many of the tendons cross to add stability, and so the tendon for the big toe crosses the tendon for the little toe, for your smaller toe, the digits. And you'll see this pattern of crossing. It kind of helps you remember where the muscles are. And the posterior aspect, the big muscles are muscles of dorsiflexion. A dorsiflexion is a toe raiser. Okay? So here we have the gastrocnemius, which is superficial to the larger muscle underneath. Most of the bulk of the calf comes from the soleus muscle, which is significantly larger. Okay? And so just a thinner layer on top of it, which gives it its appearance, is gastrocnemius. Then if you take both of those away, then you have the muscles underneath, And the deepest muscle of the lower leg is tibialis posterior. And on the lateral side, we have flexor hallucis longus. But is the big toe on the lateral side?
No.
No, the big toe's on the medial side, so this tendon must cross clear over to the other side, the big toe over there, and that adds stability to the ankle. Here's flexor digitorum longus, and it crosses back over this way. So those two tendons cross inside the ankle or underneath the foot somewhere. Okay. And so there they are, note the tendon crossing, posterior view, tibialis posterior, flexor digitorum longus, crossing to the other side, the contralateral side, flexor hallucis longus, crossing to the contralateral side. The foot is analogous to the hand, you'll be relieved to know. There are a few differences, but we have, out here we have the phalanges, and the big toe, or great toe as it's sometimes called, only has 2 bones. And so this will be the first distal phalanx, and that would be the fourth proximal phalanx. And instead of the metacarpals, these are called the metatarsals. And they are found in the arch of the foot. And just posterior to them are 3 cuneiform bones, medial, intermediate, and lateral cuneiform. Then a bone we don't see in the wrist, a big bone on the lateral side called the cuboid. And then on the medial side, a long skinny bone, which is called the navicular. And on the East Coast, guess what it's called?
The scaphoid.
Scaphoid. The muscle of the heel, or the bone of the heel, is the calcaneus, and the talus sits on top of the calcaneus. So here's a side view. The lateral view is maybe a little more revealing. Here's the calcaneus and the talus, and right here you see the articular surface for the tibio-talar articulation, which is the ankle joint. Cuboid, navicular, and there are those cuneiform bones, the metatarsal, so this would be metatarsal 5, and there would be the phalanges. Okay, and you see the articular cartilage right here, and all of these are diarthrotic joints, so they all have articular cartilage and bursa and all that stuff. So your heel bone, the calcaneus. Okay, this is a posterior view of the calcaneus, the heel bone, and there's a big shelf sticking out to the side which helps support the talus. This is one of our lab words, sustentaculum tali. Sustentaculum means to hold up or support. So this one supports the talus. It's an important landmark that is used to locate, if you're looking at slices through the foot, it's used to locate. You see, if it pops up in a slice, you know where you are. So basically, the bones of your foot form this arch, and there's lots and lots of ligamentous material stretch across that arch. You don't want to overstrain the ligamentous material, or you'll wind up with flat feet, and the foot will lose its ability as a shock absorber. But you see the arches are in really 3 different directions. Okay? Kind of an interesting picture. Okay, just tons and tons of tendons. That of course is the highly cluttered netter view. Okay, and more tendons. Okay. Nice image here, looks just like a radiograph, that's all it is. And we see cuboid and navicular, calcaneus, talus, and there's the tibio-talar articulation, and the distal fibula, which is the lateral malleolus. Okay, so what does ST stand for? Sustentaculum tali, that's the shelf that helps support the talus up here. This is your tibio-talar articulation. And you can see how the ankle kind of hinges on that. Calcaneus, navicular, cuboid. So this must be a lateral view, since you're looking at the cuboid here. Okay, posterior radiograph of the tibio-talar articulation sure looks like a hinge joint from this view. Medial malleolus, part of the tibula. The lateral malleolus is part of the fibula.
What's the name of the articulation?
What?
What's the name of the articulation?
The tibio-talar articulation. It's the articulation between the talus and the tibia. The talus and the tibia, that's your ankle joint. Okay, and this is kind of a neat view here. You can see the anterior cruciate ligament in this view. Okay. And the two condyles of the femur, and the menisci, medial meniscus, lateral meniscus. Tendons and ligaments tend to show up as black in MRI. So there we have the posterior cruciate ligament and the anterior cruciate ligament. This is a mid-sagittal. Lots of knees are done on MRI. Football players come in for knees, a knee series all the time. I used to sit in and help run MRIs by the hour. It was really fun. We got lots of football players. Being an MRI tech would be a pretty good job because you either see people in a coma or you see football players. You don't tend to see people with all kinds of things spilling out of their body and things like that. So, because you do lots of heads and lots of knees. Okay. Nice MRI, tibio-talar articulation, talus, navicular. Okay, posterior view of the talus, medial malleolus, lateral malleolus. And that's all.